Hi, everyone, and welcome to Crushing Doubts Q&A at 6 p.m. Eastern, 3 p.m. Pacific, every Monday. Looking forward to hearing your questions and getting those questions answered for you. Pleasure to be here with you as always. Just a reminder that our group memberships have started up. You can sign up for those on www.crushingdoubt.org. We also do have our next seminar coming up. That is going to be Monday, December 6th is the beginning. It is Monday, Tuesday, Wednesday, and Thursday for 2 straight weeks. They are 75 minutes each in the session. I speak for about 45 to 50 minutes, and then this Q&A afterwards. So these are especially good at getting your questions answered across the board about why you can trust this system, why it's different than the other systems, how you can get your doubt alleviated across the board. The membership groups have a different function, but are also fantastic, and I'm really pleased at how they're panning out. That allows us to go through moment-to-moment experience, and I talk about how important that is across the board. Let me say hi to a couple of people, and then we'll get to a preloaded question and dive right in. I see Doris is here and Linda Alarde. Good. I haven't seen you in a while, Linda. Welcome back. Good to see you on YouTube. I see Put Pain in the Past has joined us on Instagram, Lucy Oden, and Sarah Fire, who I know is Maureen. Good to see you. Thank you for joining us. Let's bring up the first preloaded question, because sometimes we don't get to any preloaded questions otherwise, and I like to get to those as much as possible. And we're going to get to the questions coming in across the board. Sylvia Sierra saying hi on YouTube. Good to see you. Put Pain in the Past says, hi, Dan, it's Rita. Oh, this is Rita La Barbera, who was interviewed with me. She interviewed with Tamara, and we had some really great response to that. Lots of lively discussion. And we can talk about that more. Rita, jump in as needed. We have lots to say about that. Herbert, let's leave this question up here. Lucille has this question. I'm working on alleviating doubt, and therefore I have a question about allergies or allergy-like symptoms, sinus pressure, itchy eyes, whether environmental or food/histamine driven. I know they are part of TMS, but I feel there is still confusion and fear there. Okay, so here is my take on this, and Lucille, get back to me as you watch this. Or anybody else jump in if they have questions about allergies. Allergies are like anything else in the mind-body process. And what I mean, I could mean many things by that, but what I mean in this case is that there are plenty of times where you have symptoms and they're going to end up being mind-body. Almost always that's the norm. If you have an allergy that is more life-threatening, like you're allergic to shellfish or peanuts or things like that, and you can go into anaphylactic shock, that is not mind-body. That is something that is completely biological and physiological, and that needs to be taken care of medically. Other than that, though, I find that these allergy situations are mind-body for sure. And I tend to weigh in pretty directly and heavily on these things because we know what it's like to say, if I said, oh, I'm 99% sure it's TMS, that doesn't actually help anybody. It doesn't help anybody for multiple reasons, but on top of it, it's not the right answer. The fact is, one of the things I found so refreshing and important about Dr. Sarno was his certainty. But it wasn't that he was just certain. He was certain based on science and logic. And that is what I hold myself to. If it doesn't make sense across the board, I'm not going to say it. But I've seen this not only in myself, but in many other people. Seasonal allergies, these things are mind-body. They're very driven by that. I welcome discussion about it. Let's have a discussion about it as needed. I want to get rid of doubts about this. This is an area that we can get past as a group if we recognize that triggers and beliefs are very powerful and they can lead to all kinds of things, and that gives doubt places to hide. Okay, thanks for the question, Lucille. An observation from Molly Cakes. I am so happy because my burning tongue sensation is gone. Wow, Molly. That's great. Oh, but now I have a sensation on my leg and upper arm that feels like a sunburn when I touch it. Ugh. So my question is, did my mind just go from one place to the other? To be honest, I can deal with this sensation better than the other. It is not as annoying. Haha. So, Molly, yes, this is symptom imperative all the way. And very frequently, I found this to be the case with myself. Once I get rid of one symptom and it goes to a lesser place, meaning a place that is less bothersome to me, sometimes I let it just sit there. Other times I decide to push it again. And it sometimes feels weirdly as if I'm like flipping through the pages of a book and saying, no, I don't want to read that chapter. Nope, not that one either. Don't settle for any symptom that's super uncomfortable. But Molly, I want to say this. To me, it is really encouraging and exciting that you got rid of that burning tongue sensation. To my knowledge, you had that for a pretty good long time. And, I don't know if it was because of the doubt work we've done here or other work that you've done on your own, but it is a big deal, and it will relate to doubt work, whether it was through here or not. You have come to feel more confident in this, and you mastered something. This is a big step. You can now use it to move on from that other symptom, which, again, definitely symptom substitution. And Molly says this symptom is so much less annoying. That does frequently happen. I mean, it's like, I seriously, I can push a symptom around. I'm like, nope, not taking shoulder pain. Nope, not taking heartburn. Nope. Okay, tiny itch behind my knee. I'll take it. There are times where I just settle for that. That's okay. I see Michelle and Sukante have joined on Instagram. Good to see you guys. Okay, so Molly says, I listened to you and the other Dan on here. I think you both have helped. Now, Molly, I think you're talking about on YouTube, so I think you're talking about Dan Buglio, but there's a lot of Dans, so I just wanted to make sure. Daniel Lyman is also a mind-body guy in Portland who I've had on the show a couple times. I think you're talking about Dan Buglio, pretty sure. In any case, Dan Buglio is very helpful for this as well. He's got his own way of thinking about it. Each one of us in the mind-body field helps in different ways. I am filling in an area that I felt to be missing, and sounds like we've both helped. So I'm very pleased to hear it. Linda says to Molly, "That's awesome. At least you can see your power, and is shifting the symptoms." Listen, it really is true. When you have a supposedly chronic symptom, and it gets alleviated or shifts to another one, that is the beginning of the end for chronicity. It gets to a point, like I don't have anything chronic, nothing, because it just it'll move around. I have acute stuff that pops up. I have acute stuff that pops up for emotional reasons, emotions column reasons. I have acute stuff that can pop up because of doubt. But the fact is, I don't have anything really chronic. I can't think of anything. No, there's nothing. So, Molly, I think that's where you're headed. More than think. I know it's where you're headed. I'm very excited for you. Okay, let's bring in another preloaded question. We actually have time for it. This one is from Diane. Diane said, do you have some tips for when people should seek therapy for mind-body symptoms? Okay. Well, that's an interesting question, Diane. And there's multiple ways I could go with this, but the thing that I would say at the top of things is, if you're making progress, I mean, let's say you're using my system. We'll start there. If you're using my system and you're making progress, you don't necessarily need to go that route. However, if you're using my system or somebody else's system and you are finding that the symptoms are getting worse as you work on it, that's one of the reasons that I think it's good to have a therapist, because that way you can process more of the emotional stuff and take it at a slower pace or at the pace you need to, or get some insights into it that can prevent you from having a lot of symptoms. So if you're having lots of symptom life in a very active and very unpleasant way, that's a time to seek out therapy for mind-body symptoms. That being said, once you've started that therapy, take it at the speed you need to, because sometimes your body is telling you, hey, I don't want to be doing this right now. So it's a double-edged sword. And what you have to do is think about, all right, what do I need to get unstuck? And that's the basic gist. Whether you're using my system or not, the basic gist is you want to seek out extra help when you feel stuck. Within my system, that usually is going to relate to when you have gotten to the power column, but you're not getting the movement you want. Remember, in the power column, we're dealing a lot with accepting the fullness of your trauma, finding out that core suffering you and what that all means. And that's a time when you can really use a therapist. One other time within my system that tends to be a time to use a therapist is when doubts are really, really running crazy and you can't get control of them. Those are the two times I would say are times to look out for checking out something with a therapist. Guys, let me know if you have more questions about it. Okay, Molly says to Linda, it is in the conversation about how exciting it is that she got rid of the burning mouth, which is really awesome. Congratulations, Molly. She says, it really is amazing how this had happened. It makes me even more a believer in TMS. Now, listen. When you get results, that's when you're going to believe the most, for sure. I don't blame people at all for not necessarily believing until they get the results. I mean, Molly, you've been working on this for some time, and the proof is in the pudding. The symptom actually moved. So this is pretty exciting. Now, she says this is the Dan from Pain for You, which is Dan Buglio. She said both you, but you both have helped lots. Glad to hear it, Molly. I'm really excited for you, and thank you for sharing that success story, because that's very encouraging to the people out here who are working on their things. They might think, well, I don't know. I've been working with this for a while. I don't know if it's going to adjust. It does. If you work on it, little by little, it works. In fact, I just had a membership meeting where the topic that I talked about was the idea that when you resolve one part of your mind-body process, it opens up space for other things. So, Molly, now that you nailed that, you're going to be able to move on to other parts and expand your power in this. And that's going to be really exciting. This is a fantastic breakthrough. So glad you shared it with us. Okay, Karen Isaacs, good to see you here, Karen. She says, I often find myself saying, I can't deal with certain people because their energy feels too much for me. So I check out. But by not dealing is when I get a symptom. I'm actually scared by other people's angst. Then she says, P.S. I am scared of feeling anger in the moment. So I say, I don't care, or I can't deal. Okay. First of all, Karen, this is a very, very common problem for people to experience. Anger is very hard. One of the reasons we have so many symptoms is because of anger. It's because people are taught all kinds of things about anger and generally not taught anything that makes us feel safe about having anger. In fact, there's so much judgment about anger, which is extra hard, because when you're angry, you're already hurting, and then they're going to judge it. So it can be problematic. What I would say is we want to look for a solution that can expand your power, Karen. Karen and I did an interview on YouTube where she talked about her recovery pretty soon after she discovered me. And she's come a very long way in her life. She's really got a pretty good handle on the symptoms a lot of the time. But what I'm hearing is, here's an area where you can expand. And that's one of the things I want to encourage you guys about is don't stop expanding. You can keep growing. You can keep getting a handle on new things. I've had all kinds of things that I thought I never would be able to handle that I now can. And the primary way that I've gotten to that is the power column. So Karen, what I would say, and I want you to ask follow-up questions to this as needed. I don't want to suggest anything to you that doesn't fit with where you're at. But I want you to think about the power column and what is it that you can do that is a solution that's in between not dealing and feeling stuck dealing. You don't want either of those. We want instead for you to feel like there is a functional, good way to deal with this. And I'm going to give you one example that I'm just pulling out of thin air. I do not know if it applies to you, but it just gives an idea of what I'm talking about. One of the solutions that I've come to in situations like that is to be able to acknowledge and express the anger just in words. I don't have to get super angry about it, but just express what I feel about it. And then I take this path. This is not always going to work, but it can work sometimes. I take a path where I say, I'm not actually going to care what you think about this. I know that may sound callous. This is where I'm asserting my power and saying, listen, I'm open to hearing whatever you have to say. I'm happy to be cooperative. I'm a goodist. I want to get along with people, but I also am not going to subject myself to something where I need you to agree with me. So I don't know what the cracking of the code will be here, Karen, but there's something like that opens the door to a new option. There's somebody I work with, and we talk about it as we talk about the work that she and I do as options therapy, because a lot of the time I'm helping her see, no, you're thinking one thing or the other thing, and actually there's another thing in between, something that can make you feel more powerful there. what I'm hearing in this is the symptoms are there in part because you don't yet feel powerful there. And I don't blame you, but we can do it. Okay. Hi, Mira. Good to see you. Mira says, hi, Dan. What do you think causes morning anxiety? Seems to be just upon waking with some focus on symptoms and overall jittery feeling that diminishes quickly. Is this stress hormones, adrenaline? Okay, let's leave this one up here. There's a couple things I want to address. Here's what I would say, Mira. First of all, even if there were stress hormones or adrenaline going there, you want to remember that the mind-body process causes that anyway. Those are the physical responses to the emotional situation. So one of the things that it looks like I'm losing Instagram for a second there. Okay, we're back. One of the things that I often say is, listen, let's not get confused between the results of the mind-body experience and the cause. Stress hormones and adrenaline, they're not going to cause this, even though they probably are happening. They're the result. So then the question, Mira, is, all right, what's happening? Well, as you know, I like to identify what column is at play here. To me, you go through your columns and you could find there could be a cause in any one of those columns, but you want to think about it. If you are finding a kind of conditioned response, that meaning something that happens at a similar time or with a similar activity, that speaks to the doubt column. So to me, my kind of diagnosis, I guess, I don't tend to like that term, but my way of thinking about this, better way of phrasing it, is that you're having fear in the morning. Now, I understand you're describing it as anxiety, but I want you to think about it as fear because fear is the emotional component of doubt. That's an important distinction. You could think of this as emotions column, and it could be potentially, but the fact that it happens all the time and then it diminishes quickly more speaks to the fact that there's something about the waking up experience, either something in your emotions column of, oh my God, I have to face the day and I have to do it all alone or something like that, or it's something in just the conditioned response of, morning is when this happens, boom. And then the adrenaline comes or whatever happens in the body comes. It seems to me it is a conditioned response that you're used to. The thing that I would want to think about is what is the fear? And then I would try to tie it into the emotions column and get specific, see what's happening here. Mira, let me know if I answered your question well enough. Okay, we have a question coming in from Instagram, and it fits with this, so I'm going to answer this now. Michelle says, I'm still searching for an action step for my conditioned response. Okay, so Michelle, we certainly can talk more about it. My awareness of what you and I have talked about, because we've been in touch about this, I'm curious to know more about when you say that, because it could be that we've looked at certain action steps, but they feel incomplete to you, or it could be that you are finding that you've worked on certain things and you hoped they would work, but they're not. But it also could be, and I'm just throwing this out there, it also could be that you actually have things that are working some, and doubt is convincing you that it's not working. I say this all just to show you all how varied this experience can be as you try to figure out what is happening. So, Michelle, I need a follow-up question for that, or a follow-up answer to this question. And that is, tell me a little bit more about what has unfolded with that. I of course know some things about it, but voice, what you've tried and where you feel you're at with it. DJ Moore, looks like they're in Phoenix, has joined. PHX, I think that's what it is. Okay, Michelle, I'll jump back to you more on this as you get back to me. All right, we have Mike P. Good to see you, Mike. It's been a while. He says, hi, Dan. Hope all is well. Have you had a chance to read Alan Gordon's new book? What are your thoughts on somatic tracking? I have not had a chance to read Alan Gordon's book, and that's partly because I want to wait until I can really sit down to digest it really well, but I also actually want to get my book done before I read that. I don't want things shifting around my thinking too much. I want to go in the direction I'm going in. I've heard through the grapevine a lot of what's in there. Sounds like there's a lot of good stuff. People have had varied responses as they will to anything, but there's a lot of good information in there apparently, and Alan does tremendous work. My thoughts on somatic tracking. Somatic tracking is it's a version of something that I do in the emotions column. I do pay attention to what is my body saying. And actually, I should say it's also in the power column. I pay attention to what is my body saying? What does this actually mean? So I think somatic tracking is a very good thing. My question that I would ask if I'm trying to find out more about how somebody in particular is using somatic tracking is what's the end game of it? You want to notice that experience, but then you want to have something you can do about it. So one of the things that I like to do in my columns is figure out what are we going to do about it. Okay, Amrit, good to see you here. She says, big update. ER visit last night uncovered a 5-centimeter uterine fibroid. I was in so much pain from cramps. I felt like my insides were being pulled out of me. She said, Dr. Ratner already filled you in. Stress-related for sure. Currently in bed, incapacitated even now. Mentally, emotionally, and definitely physically. What do you want to tell everybody? You and I can both agree it's stress-related. She says TMS 110%. So I do agree that fibroids tend to be the kind of thing that come from stress-related things, but of course they do need to be dealt with medically in some capacity. In terms of the pain, I'm not totally certain that the fibroid would cause pain. And in fact, I would guess not. Most of pain is mind-body, no matter what is happening, which is, it's interesting. So I guess what I would want to say, Amrit, is when you have a situation like that, first of all, make sure to check with doctors and make sure to get checked out in whatever way is needed so that you're safe and nothing life-threatening happening, which fibroids are not. But if you are finding lots of these symptoms, you want to get into some more specific understanding of what is causing that. And to me, that's all about the columns. Look at your 3 columns, see what's happening there. And Amrit, we can talk about more of the specifics of it. By the way, this is part of what the group membership is really good for, is you guys come in, you might share a certain moment, and then I can dig in and say, okay, wait, what was happening? When did you notice the symptom? When did it start? And we really get into it. And that's a really huge advantage to these membership groups. And I've been really pleased with them so far. Now, Karen Isaacs is responding to what I said before. She says, spot on, Dan. So it sounds like I had a good idea of what she was grappling with in terms of the anger. Karen, let me know if I said anything. Hopefully I said something helpful that can move you in the direction of finding an option. That's what we want to work on. But the main thing to work on, whether we go through that process or not, is to think about what option might there be. So we'll get back to you on that, Karen, as needed. Jump in and let me know what's going on in your mind after what I said. Okay, Sylvia Sierra says, can't think of a specific question lately, just struggling. Having constant head pain. Even if I can identify an emotional trigger, the pain seems so overkill, and lots of times it seems so random. Okay, hold this question here. There's a couple of things I need to say. First of all, doubt wants you to believe in randomness. It always wants to go in that direction. Yep, because if it's random, it can hide forever. And I'm saying this supportively, Sylvia, absolutely not a criticism, but it'll be helpful to you to banish the idea of randomness out of your mind. Symptoms, physical symptoms are never random. They are never random. I have challenged this over and over and over in every way that I can. I don't like to believe in any system that isn't accurate. So I've been very careful about that. But what I have found is they are never random whatsoever. So what we need to do is go back to the columns. I know I say this all the time, and I'm sorry for sounding like a broken record, but sometimes that broken record is exactly what you need. And I hear, this is not going to surprise you, Sylvia. We've talked about these kinds of things before. I hear doubt. Doubt is coming in. So, when you say having constant head pain, even the word constant feeds the doubt. I don't blame you for using it. I'm not even saying it's not accurate. I'm just saying try to recognize that's a way that doubt is getting fed. Instead, say you're having consistently acute head pain. I know that sounds like I'm nitpicking, and I don't mean to be. I'm meaning to suggest that you can change your language so that you can remember. This is actually moment-to-moment experience. And then you said, even if I can identify an emotional trigger, the pain seems so overkill. So in my experience, if you identify an emotional trigger and the pain doesn't shift, then either it's not emotions column or you haven't gotten the right emotional trigger. So it could help. I would recommend coming to the membership group, and I can help you sort this out. I think you just need a little bit of extra work, moment-to-moment work, whether in the groups or not, and it can be helpful to you. Sylvia, let me know if that answered your question, even though I know you say you don't have a specific question. We have a couple coming in from Facebook. Yulia Winter says, I can't feel anger. Tried therapist, journaling, nothing. Feel sadnesses and resentment only. How important is it, in your opinion, to feel it? Okay, Yulia, it's not important at all. I know that might be a surprising answer for some people, but the fact is, one of the reasons that I developed the system that way that I did, and the reason that the system is needed in terms of the 3 columns, is that many, many people cannot get in touch with these feelings. And as a result, they start to feel like, oh no, what am I going to do? People are telling me I need to get to these emotional results. You don't. In fact, the longer things go on, the more likely it is that you are dealing with a doubt column problem. And so you do not need to get in touch with those things. Use the columns. Build out your columns, Yulia. And what you'll find is that, and this is just a hunch, but it's possible that this is part of it. What you'll find is you've got the answers there anyway. There's nothing wrong with any of you, the way that you are. If you are a person who doesn't experience the anger so much, then either that's going to change as you look at things, especially in the power column, or you might just not be that angry. It might be more that it's sadness and resentment, and that's the way it went for you. Try not to judge who you are. And let's see where you can go from there. But in terms of how important is it, in my opinion, to feel it, not usually very important at all. Maybe in the depth of the power column where you're talking about the core narrative, you might be able to get to some there. But we can work at it. Okay. Another comment from Facebook. Ryan Edson. Good to see you here, Ryan. How do we relate to the inner child in us acting out with symptoms? For example, cold, rainy morning, an inner child is like, I don't want to go to work. And at the same time, I have a symptom. I want to acknowledge him, but not be run by him. Okay. So Ryan, acknowledging him just basically means spend that moment raging internally. You can say, yeah, I'm really unhappy about it. But here's what I want you to do, Ryan. I want you to actually, instead of just acknowledging that, I want you to get even more primitive with that child. I want you to think about the specifics of why that child doesn't like things like that. Like, it could be that there was extreme loneliness in their childhood. I'd rather you be thinking about that than thinking about the rain. So a lot of times you need to dive further into the emotion just for a bit. But remember, you're just going to dip into it. So you can say to that child, okay, I'll be with you for a little bit, and then I'm going to pull back out. But when you do go in full. And I as you connect to the depth of things, the very specific emotions in the emotions column or the core narrative, you're going to do a lot better with that. Okay, hope that helps. Michelle, I do see your response on Instagram. I'm going to get to you in 1 second, but I'm behind on some of the comments on YouTube, so I'm going to catch up there and then get to you. Okay, Linda says, I used to have panic attacks upon waking from childhood through my 30s. I participated in a program called reevaluation counseling. It unlocked something and the panic attacks just stopped. Okay. So listen, panic attacks, like any other symptom, they are a physical symptom that comes from a mind-body experience. So this is a case where Linda got to some of the specific emotions column stuff is the language I would put it in. And this is a good example of it. So thank you for sharing that, Linda. Okay, Christie Lee MeKinney. Oh, I'm sorry. She says that her grandma died. I'm sorry to hear that, Christie. Very sorry. I have been unable to cry, but have insomnia, stomach pain, and anxiety. I feel my symptoms are creating a lot of difficulty, but hiding my ability to process. Advice. Okay. A couple things. First of all, again, Christie, I'm very sorry to hear that. The thing that I want you to do, and this is kind of power column work, we have to remember there's nothing wrong with who you are. There's nothing wrong with how you process this. What I want you to do is give yourself time and space to feel what you feel, but to remember that the body may be expressing the thing that your mind can't really attach to. So let's say you're having pain and anxiety. I want you to take your body at its word and know that means you're having pain and anxiety about this. And that way you are processing it. You're just processing it through the body instead. What I want you to recognize, though, is you're not failing to process this. You are processing it. And that could put you at some ease. It also could reduce some of the symptoms. Otherwise, I want you to spend time thinking about the emotions column themes. You don't have to get in touch with the feeling. You have to hit on the right idea within that column, and that can take away the pain, just so there's something you can do. Christy, keep me posted on that and whether that's an answer that helps you. Dorisa says, for me, it was fear of my pain and fear of the future. And she was talking about morning anxiety. So, yeah, listen, mornings, they can bring up a lot of stuff. You know, you're facing a lot of stuff. Oh, Christy said, sorry, it cut off. She had more to say about that. Okay, I'm going to jump back in about that. But Dorisa, thank you for sharing that. Fear of pain and fear of the future. When I used to wake up with my back pain, when I used to wake up even before the back pain was there each day, I would sometimes say like, well, I'd check in and be like, how's my back? It was the first thing that I did. So I can really relate to what Dorisa's saying. Morning can bring that up a lot. It also can come up because of dreams that we were having. The mornings and nights, those two poles of the day, can be tough to take in certain ways. Christy, I'm going to get to the rest of your question, and then I will jump to you, Michelle, on Instagram, and then a couple more on YouTube. Okay. So Christy said, sorry it cut off. My daughter's is struggling as well, and I've been unable to be patient and loving in the way I'd like to. Which column or steps would you recommend? Bringing up old family dynamics. All right. Well, Christy, this is a situation where you need all three of your columns. I find this is often the case. I need all three of the columns, and I go through column by column in each situation to think about what is it I need here. In the emotions column, I want you to look at which themes are getting activated here. And just spend time recognizing that, especially when there's the onset or uptick in a symptom. Other than that, you actually don't need the emotions column that much. When it comes to doubt, I want you to look at, have doubts gone up? Because when doubts do go up, it can get very upsetting. It can leave us cranky, irritable, struggling, not at our most patient selves. Can be tricky. But the main place to work here, Christy, is the power column. The power column is really about whether you feel like you have integrity within yourself. I don't mean integrity like acting in a way with integrity in the world, but I mean a sense of yourself as not damaged or broken. And you aren't. You're going through something really hard. Your daughters are struggling too. It's very hard as a parent to see that, and can be very upsetting. But I want you to connect to that core narrative again. Look at who you are. Fit this into that. Where does this fit in? And what is the powerful move for how you can deal with this? That could be that you could say to your kids, hey, I know I'm not at my best right now. You know, we just lost grandma, you know, whatever you called her to the kids. And it's really hard for me. So let them see who you are. Let you be who you are. Don't criticize yourself for how you're doing it. Let's start there, Christy, and tell me if that is of help. Now, one thing I want to mention, I did mention it before, but the seminars, the last one of the year is coming up again. It's December 6th is when that starts up. You can sign up for it on www.crushingdoubt.org. If you're looking to get started with work sooner, the membership groups are always available for sign up. They're monthly memberships, quite affordable as these things go, hugely affordable actually as these things go. But it gives you a chance to interact with me on a regular basis. It's also a great combination, the seminars and the groups. Okay. Back to Michelle. Now, she was talking about conditioned responses. She says, I go straight to fear. I try self-soothing. I try positive talk. Not sure what direction to go. Hard to do a complete analysis of it at 4 a.m. It sure is, Michelle. But the thing is, this will get easier with practice. We've been talking about this some, but what you want to do is to start at that first moment. We talked about this the other day, but I'm going to reiterate this and see if we can expand from it. You want to start at that first moment. You know, what is the fear? It's okay that you go straight to fear. I'm not saying it's okay, meaning I'm fine with that, because I actually don't like that for you. It's no fun. But what you can do is to say, okay, I went to fear. What is the fear? You know, take a beat and see if you can consider what is the fear here. Now, and then you want to counteract that fear. You don't need to do a complete analysis of it. You just need to get that one moment first. So let's say the fear is, this symptom just came up. This one's going to be worse than it was in the past. Well, why would it be? You need to challenge that. And I think sometimes self-soothing or positive talk, sometimes they work and sometimes they don't. And when they don't, throw it out for that time and look for something that does. A lot of times people try positive talk, but they're really just saying it. If you don't believe it, it's not going to help you. If you try self-soothing and it's not working, it's not going to help to keep doing it, right? So the thing that you want to do instead is take a step back and get more intellectually focused to consider what is the actual fear. Get it articulated. That's the one thing I would recommend in that situation, Michelle. Get it articulated. When you're talking about not having an action step, that's partly because of what you're describing, that you go to fear and you kind of get stuck in that loop, which many people do. But if you articulate it, then we can either get rid of it, or in articulating it, we can understand what is the problem and that's how we can start to consider what can be addressed. Okay, Carolyn Arnott, I see you on Instagram. Good to see you here. And Michelle says, thanks, that's helpful. I'm glad to hear it, Michelle. Let's keep at it, but I'm on to the right thing there. We'll get to it. Keep up the good work. Okay. All right, Mira is responding to what I said. She said, thank you, Dan. Yes, it's definitely conditioned. Your answers are always spot on. Much appreciated. Thank you, Mira. I appreciate the nice praise, and I'm glad that my answers are helpful to you, and hopefully they are to the other people watching as well. Okay, and Carolyn, you're saying hello. I want to say hi to you. Good to see you. Okay, Molly says, off topic, but Dr. Dan, have you ever watched The Sopranos? If no, you should. Ironically, I have seen probably like half an episode of The Sopranos, which, I know. A lot of people say, hey, you should see it. And I also know there's a therapist in it and everything. Tony had anxiety and TMS, and I've heard that as well. Fictional character, of course, but it is interesting to see it unfold from his stress. Molly, I would say this is not very off topic at all. In fact, it's really something that I like to see when people represent a mind-body condition well. And even if it's not represented super, super well, at least it's in the consciousness. It's such a great thing. So the fact that Tony Soprano had that is something that's definitely been on my radar. And I am just glad it's there. It means that writers are thinking about this. People are thinking about this. It's getting talked about. I was just talking about this in the membership groups today. There's a small handful of people in the world who really know like the column system, but that is thankfully expanding. But there's a lot more people that are starting to get the idea of mind-body issues. We're seeing articles in the New York Times. We're seeing more books come up about it. We're seeing more professionals go into these things. It's coming up on shows. And this is a great thing. We got to keep working at that. All right, back to you, Sylvia. You said, okay, I can banish randomness. Good. Listen, I know that could be easier said than done. If you need more help with that, just let me know. She says, I know I've had a lot of stress in the past week or so, and that must be why this uptick in pain. The pain does vary. Headache, worse headache, migraine, repeat generally. And then Yulia said, hey, Sylvia, sorry you were struggling. Let's see. Hold on a second. Looks like they're having a conversation. I will highlight that in a second. But Sylvia, for you, yes, if we can banish randomness, then we can go to the columns. The columns give us the answer. If the emotions column is the column, but working in there is not solving it, then that means the issue is you must not be getting the specific thing. I think I talked about this the last Q&A. It might have been 2 times ago. I had pain for about two straight days. Pretty bad pain. Back pain. And that's not usual for me. And I started to think, well, I don't know what this is. Maybe why can't I figure this out? I kept going over and over it. Finally, I got a clue that reminded me, this is emotions column work and I'm missing it. I don't know what it is, but I know I'm missing it. The clue was I had a certain type of physical feeling that's always there with the emotions column. And I've been saying to people, don't just learn the system. Learn your columns, how they operate for you. So that physical feeling is always emotions column for me. I went back there. I looked. I thought about the timing. I went back to the basics. Went to the timing, and the timing was what really did it. So Sylvia, when you get these upticks and these variances, they're not random. They are clues. Always clues. Find out why. Think about what theme was there. And what happened for me is a theme that I was not seeing. And it was hiding among a bunch of themes it could have been that seemed even more likely. But as it turned out, it was not that. It was something else. All right, now let me see what Yulia is having a conversation with Sylvia here. She said, as someone whose TMS is head pain, the power column is very important. Supporting yourself, self-soothing, feeling like the pain will not rule your life. Then she said, I feel for me, Sylvia, that working with the emotional column helps long-term, kind of like prevention. When I am exacerbated, power column helps most. Just my experience, maybe it will help. And then Sylvia says, thanks, Yulia. I'm probably struggling with power right now, especially with work. I feel like I just can't get a break, literally no time off, along with some other things. This is a really great discussion. And thank you, Yulia, for supporting Sylvia there. And I guess I would say that one of the things that is important here that's being observed is just how much the power column can be playing a big role, but even more so how much the power column can be a solution. I really do find more often than not that once I go through my columns, once I address the emotions column, once I address the doubt column, the thing that is left, the place to live, as I say, is the power column. So much of the time we don't feel powerful. Society doesn't really help us feel powerful. If anything, they're always trying to tear us down. I'm not saying it negatively about society so much, but there's a lot of aggression out there that comes our way. A lot of people feel like they want to be powerful by making sure we're not powerful. It doesn't work that way. We can all be powerful at the same time, and that's the goal. So thanks for these observations. I think that is really important. A couple more observations and questions, and then we'll wrap up for today. So Amrit says, yes, the group membership is on my to-do list. That's good to hear, Amrit. I've come a long way since working with you in 2014, and there's still a ways to go. I'm forever grateful for our progression in our work. Thanks, Amrit. That's sweet. And I know we've done a lot of good work. She says, I need to reach out with group membership, and part of that slight trepidation is fear of exposure. I will save everyone my life sob story and just say that Dr. Ratner's approach works. Thanks, Amrit. So listen, sometimes people hesitate to come to the group aspect of things, and I do understand it, but the good news is this is not exactly group therapy. It doesn't have to be that exposing. You are going to do work on your columns. If you have questions, you're going to ask them. You don't even necessarily have to get into the specifics. It's like I've said to people, the thing that I wanted when I was getting better, I didn't want a mind-body informed therapist. I mean, that's nicer than a non-mind-body informed therapist. But what I really wanted was a therapy-informed mind-body expert. And that is what these group memberships are like. We're not doing therapy per se. We are, listen, it can be therapeutic. It certainly is empathic. It's supportive. We talk to each other, and it's a great group because it's a bunch of goodists. You can't get a better group than these people. But the group dynamic actually can really help you because you learn not just from you, and you're not just stuck in your process. You can hear somebody else's process and how it's playing out. So I highly, highly recommend it for multiple reasons. Okay, Maureen says, I am experiencing more anger. Is that normal in processing the right core narrative and emotional trigger? Yes. This actually, though, fits with Yulia's question from Facebook. It is normal to have more anger come up as you're processing, but it's also not the case that it would be abnormal to not have it. Basically, the way to think about it is that when you are processing these things start to shift around. And they start to shift around in ways that relate to you and who you are. Let yourself be who you are. I'm saying this partly to address the question that Yulia had on Facebook. You don't have to be that way. But it is a pretty common experience that we can get to the heart of these feelings quite a bit. No matter what the case is, you can get your solutions in these columns. And it's very, very nice to be able to look in each of these columns and also to know there's no other columns. There's no other place you need to look. I'm very comfortable and confident saying that. I have mastered my symptoms for years and years and years using these columns. I don't need anything else. And they not only have helped me master the symptoms, I was saying to somebody recently, I feel like I'm living my best life. I'm not saying that to brag. I'm saying it because you can too. And the columns are the things that help me do it. Okay, couple last ones from YouTube, and then we'll wrap up for today, but we'll be here next week. Sylvia says, now that I'm reflecting on it, one common theme with these upticks could be time pressure. Aha, like running out of time, worried about being late, missing something. I'll have to explore this, I guess. Okay, Sylvia, we're on to something. When you, there's reasons I like this particularly. It is very broad, and it's also high stakes. If that's a thing that you haven't explored much and it relates to the upticks, you're onto something. Explore it. Come back. Let's talk about it. Patty says the group membership is so helpful. This is the only way I feel safe and accepted. Thanks, Patty. That's very good to hear. And I'm glad that you're having a good experience with it. I think you're doing great work in there. I'm seeing great work from everybody in there. It's really exciting to finally have a system in place. I mean, look, guys, I'm going to say this just totally straight out. It has been hard to build the system that works for everybody because there was so much to build. And I had to put things in place with as much priority as I could place on them each step of the way. But I'm feeling much more comfortable now with the whole system that I have set up. The column system I've been very confident about, but first I had to get the seminars in place because people needed the full range of information. And I needed to get that to them. The group membership are kind of the next step, or sometimes even the step before that, where you get to process your moment-to-moment experience. So we're going to wrap up here for today, but to sign up for either, you can go to www.crushingdoubt.org. I have been very, very pleased with the results for both things. And there's so many ways that we can get you help. But the bottom line is use your columns, keep the questions coming, recognize that doubt is going to always try to creep in. It's going to try to creep in by making you feel confused or feel hopeless. These are forms of doubt. Pay attention to them. Keep fighting it. You're doing a great job, and I'm here with you. Thank you, guys. Looking forward to seeing you same time next week.